Past 14 years, from what I've seen of the healthcare industry, we've seen it really transform itself in lots of ways. I have to say that this has been despite the government or despite government support. The Indian market and the Indian healthcare industry has actually taken upon itself to follow global standards, global protocols in one part of Indian healthcare. And to be able to really provide cutting-edge solutions, to be able to invest a lot into R&D, provide really good quality healthcare, whether it's in diagnostics or whether it's in treatment. But the reality is that we are really living in two Indias in, I think, every aspect of the country, and in healthcare as well. There is in healthcare in India, which is, like I mentioned, global quality, cutting edge, 5-star hospitality, very good premium service. And then there's another India, which is rural India, and which is even urban poor in India, which basically is left to getting healthcare from the completely unorganized sector. Today, the biggest challenge, whether it is in treatment or whether it is in diagnostics, is a patient doesn't know what quality of healthcare they're getting. They could go to a small nursing home somewhere, and whether they get the right kind of surgery, the wrong kind of surgery, they just don't know, because that nursing home has never been checked. There is no minimum standard they're following. There is no accreditation protocol for them. Nobody from the government is checking, so pretty much it is a free-for-all. So what we've seen in the last 14 years is, because of market forces and market dynamics, certain companies have taken the right path and have gotten better and better every year, and majority of them have not. In diagnostics specifically, there used to be a time, I remember in 2001 when I started to build Metropolis, where the concept of a pathology laboratory was really a patient walking into a 100 square feet center. Sitting down, disposable needles, disposable gloves. These were not common practices at the time. It was done in very few places. Somebody's blood was taken. Everything was manually written. There were errors made on a manual basis, whether it was in name, whether it was in age, whether it was in what test needed to be done. Tests were conducted on very basic equipments with basic chemicals, which were not, again, quality, not following quality global protocols at all. And results, therefore, were shoddy. Today, this experience is totally different, where today when somebody walks into a Metropolis lab, first of all, you're exposed to a customer environment which was never existing before. You're walking into great ambience, you're walking into professional courtesy, professional situations where you're not made to wait. There are priority lines given for people. You can make an appointment. You don't even have to come to the center. Somebody will come to your house and collect a sample. The entire process from sample collection, you get an SMS confirming your appointment is fixed for a certain time. You immediately walk in. Everything is safety and hygiene protocol driven. Your blood is collected. The entire process is automated. So there are no errors along the way, and your result is delivered to you in 5 to 6 hours after being seen by super specialists in healthcare. So the entire experience has dramatically changed, and this is not only in cities. This is actually also being offered in small towns, even in smaller parts of rural India. So I think we've also had a chance to build access to some limit. Unfortunately, the challenges that we see in healthcare are tremendous. Starting from what I mentioned, no regulation, no minimum standards. Therefore, it's a lot of fly-by-night operators in healthcare today, a lot of quacks in healthcare today. So from a patient's point of view, no transparency in healthcare. Second, the fact that health insurance has only come into India in a large way in the last few years. Today, still only 10% of India is actually insured by any sort of insurance cover. And also this insurance is limited, so it will only cover certain kinds of diseases, not certain disabilities. Something as basic as diagnostics, which is OPD, where you walk into a center and you get tests done, is not covered by health insurance today. So this is a huge challenge facing healthcare as well. Third, the fact that everything is manual. All the stakeholders, whether it's doctors, hospitals, insurance, diagnostic centers, chemists, are all operating on paper. Nothing is digitized. Therefore, the patient's record and the patient's history lies only with the patient. Now, this is disastrous in many ways, because you're not building up like how you build up for a bank. You build up credit history, and you've monitored an individual's financial track records, based on which you can give loans correctly, based on which you can put market rates correctly. The same way for healthcare, you need actually a historic record of each patient, which we are not building today. And this is actually going to jeopardize us even further as we go along in the future. That's a third big issue that we see. Costing and affordability, pricing to the patient is a huge issue. Today, a lot of patients are getting bankrupt because they're not able to afford healthcare when it's their time of need, or when their family members are sick. And today, health insurance, even though has been made cheaper, like we said, is only in 10% of India. So healthcare, I think cost is a huge issue today, and a large part of this is because of the leakage in the system. We estimate about 30-40% of healthcare costs are unnecessary today, and they're because of corruption, because of leakage, are unfortunately making it more expensive for the patient. Even from the government side, today there are a lot of taxes in healthcare. Whether it is when we import chemicals, we only use the best reagents and chemicals from across the world in diagnostics. We import everything because there is no manufacturing indigenously happening in India. And when we are importing these things, there are huge import taxes and customs by the government as well. That gets passed on to the patient. So like this, we are seeing still a number of issues where when a patient is treated, when a patient has gone through diagnosis, there is no standard protocol at all. Anybody can do whatever they want. A nursing home may do the same surgery in a very different way, and in a top grade hospital will do it in a different way. An unorganized lab which is 50 square feet will not do the test if they don't want to. Somebody walks into a Metropolis as a globally accredited lab chain, you will get it done in the best way possible. So there is no standard protocol, and the patient doesn't know any better, and sometimes the doctor doesn't know any better. So huge issues to face. But we've made a lot of progress in the last 14 years, but I'm very hopeful that in the next few years, we should make much faster strides as we go along. The fact that our primary healthcare in rural India is mostly government driven. Government is as a provider, not as a payer, actually delivering healthcare, and they are not able to. I mean, for them to be able to provide healthcare to 1.2 billion people, of which 60% who live in rural India, is virtually impossible. No government in the world can do it. So unless private healthcare gets involved in rural India and starts actually working with the government to provide effective, cost-wise and quality-wise solutions to rural India, the situation is not going to change. And I think the new government is now understanding of this, and is cognizant of the fact that private and public markets have to work together. I think there are a lot of things which are possible to do in rural India. We talk about telemedicine, we talk about telediagnostics. There is absolutely no reason why, if we were to use technology, with the number of cell phones we have in India, the kind of technology and infrastructure and engineers we have in India, there's no reason why we can't use the e-Chopal mechanism and actually extend it to healthcare, where today basic primary things are taken care of course locally there. Now for that to happen, you have to create centers where you're drawing good talent to actually stay in these local primary markets. For doctors to want to live in rural India, you have to give them education for their children and their families. You have to give them proper infrastructure for their families to want to live there. So if you actually look at the model that's followed in the US or in some other westernized markets, you have to build rural India as a community base, not only in terms of healthcare, but in terms of infrastructure, in terms of clean water, in terms of education, that allows good talent to move from cities to rural India. We build them as healthcare hubs, and we have to give incentives to doctors to want to go and practice in rural India. Today it is a penalty. Every doctor is told, you go and spend 2 years in rural India, otherwise you will not get your certification to come to urban India. This cannot be a stick approach, it has to be a carrot approach. You have to give a carrot to doctors to move to rural India, work there, do their training there, give good quality healthcare locally, hold them accountable with outcomes, and not just with time and not just with money, but hold them accountable to delivering certain statistics on good quality healthcare, and use technology to do it. I think once we start doing that, we'll see a transformation happening in rural India, and most important, incentivize private companies to go to rural India and deliver healthcare in a cost-effective approach. Today, if the government talked to Metropolis and said that, look, we have 300 towns and let's say, or 5,000 villages in these parts of West and South or North India, and we want you to take a contract where we're going to give you these many volumes of patients, where we expect in every village there are going to be 100, 200, 300 patients a year who are going to need diagnostics, and we're going to pay you for it. Today we'd be very happy to take that kind of project and say, we'll go and do it in 5,000 villages, we'll deliver quality, and please hold us responsible for it. Hold us responsible for the quality of diagnostics that we're delivering. But today, when the government is not coming forward and saying, this is the volume, how does a private industry go in there? Because today we don't even know what numbers there are in rural India. We don't know whether it's possible for us to be able to cut costs to make profit. So unless we work closely with the government, this is not going to be possible.